Hello all, hope you're doing well today. Today we are continuing our conversation in chapter 22. This is part 2. We're talking specifically about multiple sclerosis and epilepsy. Multiple sclerosis, or MS, is a chronic autoimmune disease that affects the central nervous system, which includes the brain and spinal cord. In MS, the immune system mistakenly attacks the protective covering of nerve fibers, or the myelin, leading to inflammation and damage. This disrupts the normal transmission of electrical impulses along the nerves, causing a wide range of symptoms. Here are some key points about multiple sclerosis. The symptoms of MS can vary widely among individuals and depend on the location and extent of the damage in the CNS. Common symptoms include fatigue, muscle weakness or spasticity, difficulty with coordination and balance, numbness or tingling, problems with vision such as blurred or double vision, cognitive impairments, and changes in sensation or mood. Symptoms can fluctuate and may worsen during periods of inflammation or disease activity known as relapses, and improve or stabilize during periods of remission. There are several types of MS, including relapsing remitting MS, or RRMS, which is characterized by clearly defined relapses followed by periods of partial or complete recovery. Primary progressive MS, PPMS, which involves a gradual worsening of symptoms without distinct relapses or remissions. Secondary progressive MS, or SPMS, which follows an initial relapsing remitting course and then progresses steadily over time. And progressive relapsing MS, or PRMS, which is characterized by a steady progression of the disease along with acute relapses. The exact cause of MS is unknown, but it is believed to involve a combination of genetic and environmental factors. Certain risk factors, such as having a family history of MS, being a woman, living in a temperate climate, and having certain viral infections, may increase the likelihood of developing the condition. Diagnosing MS can be challenging as there is no single definite test for the disease. Diagnosing MS can be challenging as there is no single definitive test for the disease. Medical professionals typically rely on a combination of medical history, neurological exams, imaging tests such as MRI, and other diagnostic criteria to establish a diagnosis. Additional tests such as lumbar puncture or spinal tap and evoked potentials may be used to support the diagnosis. While there is no cure for MS, various treatment approaches are available to manage symptoms, slow down disease progression, and improve quality of life. Treatment options include disease-modifying therapies to reduce the frequency and severity of relapses, symptomatic treatments to alleviate specific symptoms, rehabilitation therapies such as physical therapy, occupational therapy, and speech therapy to enhance function and mobility, and lifestyle modifications such as regular exercise, stress management, and a healthy diet to support overall well-being. Managing MS often requires a multidisciplinary team approach involving neurologists, physiatrists, rehabilitation specialists, nurses, therapists, and other healthcare professionals. This comprehensive approach helps address the diverse needs of individuals with MS and provides personalized care and support. It's important for individuals with MS to work closely with their healthcare team to develop an individualized treatment plan that addresses their specific needs and goals. Ongoing monitoring, regular follow-up visits, and proactive management can help optimize outcomes and improve quality of life for individuals living with MS. Multiple sclerosis, or MS, can be categorized into different stages based on the progression and severity of the disease. While the course of MS can vary widely among individuals, there are generally recognized stages of MS. The initial stage, which is early or relapsing remitting MS, and the late stage progressive MS. Here's an overview of these stages. With the initial stage, the early or relapsing remitting MS, this is the most common form of MS at the time of diagnosis. Individuals with RRMS, or relapsing remitting MS experience episodes of relapses or exacerbations where new or worsening symptoms appear, followed by periods of remission where symptoms partially or completely subside. During the relapse phase, symptoms may include fatigue, muscle weakness or spasticity, difficulty with coordination and balance, sensory changes, vision problems, and cognitive impairments. These symptoms can vary in duration and intensity, and different symptoms may arise with each relapse. With late stage or progressive MS, with primary progressive MS, particularly PPMS, it's characterized by gradual and steady progression of disability from the onset without distinct relapses or remissions. The progression of symptoms may be slow or more rapid, and individuals may experience occasional plateaus or temporary improvements. Secondary progressive MS, or SPMS, follows an initial relapsing remitting course where individuals initially experience distinct relapses and remissions. After time, SPMS transitions into a progressive phase with a gradual worsening of symptoms and a reduction in periods of remission. Progressive relapsing MS, or PRMS, is a less common form of MS characterized by a steady progression of disability along with acute relapses. In the late stages of MS, individuals may experience increased disability. The progression of MS can lead to more severe and persistent symptoms such as muscle weakness, mobility limitations, and difficulties with coordination and balance. Some individuals may experience cognitive impairments, including problems with memory, attention, information processing, and problem solving. Fatigue is a common symptom throughout the course of MS, but may become more pronounced in the late stage, affecting daily activities and overall energy levels. Increased challenges with mobility and daily living. As the disease progresses, individuals may require assistive devices such as canes, walkers, or wheelchairs to aid mobility. They may also require assistance with activities of daily living such as dressing, bathing, or eating. Living with progressive MS can lead to emotional challenges, including frustration, anxiety, depression, and adjustment difficulties. Support from healthcare professionals, family, and mental health specialists is crucial in managing these aspects. It's important to note that the progression and symptoms of MS can vary greatly among individuals, and the course of the disease is unpredictable. Effective management of MS involves early diagnosis, close monitoring, individualized treatment plans, and ongoing support from a multidisciplinary healthcare team. Exercise testing and training for clients with multiple sclerosis can be an important component of their overall management and rehabilitation. Exercise can help improve cardiovascular fitness, strength, flexibility, balance, and overall well-being in individuals with MS. However, it is essential to approach exercise testing and training with caution and consider individual abilities and limitations. Here are some considerations for exercise testing and training for clients with MS. Exercise programs for clients with MS should be tailored to their specific needs, abilities, and goals. A personalized exercise plan can address individual strengths and weaknesses and accommodate any mobility limitations or other MS-related symptoms. A well-rounded exercise program for clients with MS may include a combination of aerobic exercises, such as walking, cycling, or swimming to improve cardiovascular fitness, resistance training to build strength and muscle tone, flexibility exercises to enhance range of motion, and balance and coordination exercises to improve stability. Exercise intensity and duration should be gradually increased over time to avoid excessive fatigue or exacerbation of symptoms. Starting with lower intensity and short durations and gradually building up can help individuals with MS safely adapt to exercise and avoid exertion. Monitoring fatigue and energy levels in MS is extremely important, and individuals may have limited energy reserves. It's important to consider fatigue management strategies, such as scheduling exercise during times of higher energy levels, incorporating rest periods as needed, and monitoring fatigue levels during and after exercise. Exercise programs may need to be adapted or modified based on individual abilities and limitations. This can include using assistive devices for balance or mobility, support, modifying exercises to accommodate specific impairments, or incorporating seated or supported exercises as needed. Exercise sessions may benefit from supervision or guidance from trained professionals such as physical therapists or you experienced and working with individuals with MS. They can provide instruction on proper exercise techniques, monitor form and safety, and offer support and motivation. Regular reassessment and modification of the exercise program in collaboration with their healthcare professionals is crucial to ensure that the program remains appropriate and effective for the individual's changing needs. Exercise should always be approached with caution and under the guidance of healthcare professionals, taking into consideration any unique considerations or precautions for each individual with MS. It's important to note that heat may exacerbate symptoms of MS, so making sure to exercise in the early morning if you're exercising outside or in air conditioning type of environment. They should have a comfortable environment for exercise that can enhance the physiological benefits and increase their adherence to exercise. And as always, make sure they have proper hydration. It's really important to help maintain temperature balance during exercise with those with MS. Medical clearance is important for before exercise testing. So before initiating the exercise program, individuals with MS should undergo a medical evaluation to ensure they can safely participate in exercise. This may involve consultation with their healthcare professional to assess overall health and identify any specific considerations or precautions. Functional assessments can help identify the baseline abilities and limitations of individuals with MS. These assessments include tests of strength, balance, flexibility, cardiovascular fitness, and functional mobility. During exercise testing, it's important to closely monitor any adverse symptoms or changes in MS-related symptoms such as fatigue, muscle weakness, coordination, difficulties, or changes in balance. This allows for adjustments in exercise intensity and modifications to ensure safety and optimize benefits. Resistance training can be a valuable component of an exercise program for individuals with multiple sclerosis. It can help improve muscular strength, endurance, functional abilities, and overall quality of life. However, it's important to approach resistance training with caution and consider individual abilities and limitations. Here's some considerations for resistance training with individuals with MS. Resistance training programs should be tailored to the individual's specific needs, abilities, and goals. Each person may have different strengths, weaknesses, and limitations, and it's important to design a program that suits their unique circumstances. Correct form and technique are essential to ensure safety and effectiveness. It's important to teach and reinforce proper lifting techniques for each exercise, emphasizing proper posture, body alignment, and controlled movements. Working with a qualified exercise professional or physical therapist can be beneficial in ensuring proper form and technique. The resistance level should be appropriate for the individual's current fitness level and strength. Important to start with a weight or resistance that allows for proper form and technique while still providing enough challenge to elicit strength gains. Gradually progress the resistance as strength improves. Resistance exercise should target the major muscle groups of the body, including the legs, hips, backs, chest, shoulders, and arms. This can be achieved through a variety of exercises such as squats, lunges, deadlifts, chest presses, shoulder presses, rows, and bicep curls. Depending on the individual's specific limitations or impairments, certain exercises may need to be modified or adapted. This can involve using equipment such as resistance bands, stability balls, or modified machines, or adjusting the range of motion or body positioning to accommodate specific needs. Like any exercise program, resistance training should be progressed gradually over time. This can involve increasing the resistance, the number of repetitions, or the number of sets. Gradual progression allows the individual to adapt to the demands of the exercises and avoids excessive fatigue or the risk of injury. Individuals with MS may experience fatigue and other MS-related symptoms that can impact their ability to engage in resistance training. It's important to monitor fatigue levels during and after exercise and adjust the program as needed. Incorporate rest periods between sets or modifying the training frequency or duration can help manage fatigue. And periodization is a training strategy that involves organizing resistance training into different phases to optimize performance and prevent overtraining. It can be beneficial to incorporate periodization principles into the resistance training program for individuals with MS. This can involve varying the intensity, volume, and exercises throughout different phases. Safety should always be priority when engaging in resistance training. This includes using appropriate equipment, maintaining a safe training environment, and being aware of any precautions or contraindications based on the individual's specific health status and MS-related symptoms. As with any exercise program for individuals with MS, it's important to make sure that you're consulting with their healthcare professional to develop a tailored resistance training program that addresses their needs and considerations. Regular monitoring and reassessment and modifications to the program should be made based upon the individual's progress and changing needs. Aerobic training can be beneficial for individuals with multiple sclerosis. Aerobic exercise helps improve cardiovascular fitness, endurance, mood, and overall well-being. Here are some considerations for incorporating aerobic training into an exercise program for individuals with MS. Aerobic training programs should be individualized, of course, to meet the specific needs and abilities and goals of each person. Consideration should be given to their current fitness level, mobility, and any limitations or symptoms they may experience. Choose low-impact aerobic exercise that minimizes stress on the joints and reduces the risk of injury. Examples include walking, cycling, stationary or outdoor, swimming, water aerobics, elliptical training, and recumbent bike. Thus, these exercises provide cardiovascular benefits while being gentle on the joints. Start with a comfortable intensity and duration and gradually increase the intensity and duration over time. Gradual progression allows them to adapt to the demands of aerobic exercise and minimizes the risk of overexertion and exacerbation of symptoms. Consider incorporating interval training into the aerobic program. Interval training involves alternating periods of higher intensity exercise with lower periods of lower intensity or rest. This can help improve cardiovascular fitness and endurance while allowing for recovery during the lower intervals. Individuals with MS may experience fatigue, heat sensitivity, and other MS-related symptoms during exercise. It's important to closely monitor fatigue levels and symptoms during and after aerobic training sessions. Adjustments in intensity, duration, or exercise timing may be necessary to manage fatigue and optimize safety and benefits. Heat sensitivity is common in MS, and individuals may experience increased fatigue or worsening of symptoms in high environments. Implement cooling strategies such as exercising in air-conditioned environments, using cooling vests, or taking breaks in shaded or cooler areas to help manage heat-related symptoms during aerobic training. Safety should be a priority during aerobic training. Ensure proper footwear, use appropriate safety equipment, and choose exercise services that are stable and safe. It's important to be aware of any specific precautions or contraindications based on the individual's health status and MS-related symptoms. Encourage individuals with MS to engage in aerobic activities they enjoy. This can help increase motivation and adherence to the exercise program. Incorporating activities that they find enjoyable, such as dancing, hiking, or playing a sport, can make aerobic training more engaging and sustainable. Some individuals with MS can benefit with the supervision or guidance from trained professionals. They can provide support, guidance on proper exercise techniques, and assist with modifications. It's always important, again, to consult with their healthcare professional to develop an individualized aerobic training program. Regular monitoring, reassessment, and modifications to the program should be made based on their individual progress, symptoms, and changing needs. Designing an exercise program for clients with MS, it's important to consider their individual needs, limitations, and goals. Here's some guidelines to keep in mind when creating a program for clients with MS. Tailor the exercise program to their specific needs, taking into their account their physical abilities, symptoms, and preferences. Consider their current fitness level, mobility, balance, and any limitations or impairments they may have. Incorporate a variety of exercise modalities into the program to address different aspects of fitness and function. This may include aerobic exercise, resistance training, flexibility exercises, balance and coordination, and functional movements. Start with a comfortable intensity and gradually increase the difficulty or intensity of the exercise over time. This allows them to adapt to the demands of the program and prevents excessive fatigue or exacerbation of symptoms. Progression can include increasing reps, sets, weights, duration, or intensity as tolerated. Emphasize exercises that improve functional movements and activities of daily living. This can help clients maintain or regain their ability to perform tasks independently and improve their overall quality of life. Include exercises that target balance and coordination to help improve stability and reduce the risk of falls. This can involve activities such as standing exercises, single leg balance exercises, and coordination drills. Be prepared to modify exercises or provide adaptations based on individual limitations or impairments. This may involve using assistive devices, adjusting range of motion, providing additional support, or modifying the exercise equipment. Include exercises that target the core muscles and promote proper posture. This can help improve stability, balance, and overall body alignment. Fatigue is a common symptom in MS, and it can impact exercise performance. Monitor their fatigue levels during and after exercise and adjust the program as needed. They may involve incorporating rest periods, scheduling exercise during times of higher energy levels, or modifying exercise intensity or duration. Consider incorporating mind-body exercises such as yoga or Tai Chi into the program. These activities can help improve flexibility, relaxation, and overall well-being. Continuously assess and reassess clients' progress and modify the program accordingly. Work collaboratively with the client and their healthcare team to make adjustments based on their changing needs, abilities, and goals. Prioritize safety through the program. Ensure proper warm-up and cool-down, use appropriate equipment, provide clear instruction and demonstration, and closely monitor them during exercise sessions. Consider any precautions or contraindications based on their specific health status and MS-related symptoms. It's important to work in collaboration with their healthcare professionals and to develop and modify the exercise program. They can help provide guidance, support, and specific recommendations based on the individual's unique needs and circumstances. Working with individuals with MS, it's crucial to consider certain precautions and guidelines to ensure their safety and optimize the benefits of exercise. Here are some key precautions and guidelines to keep in mind. Prior to starting an exercise program, they should obtain medical clearance from their healthcare provider. This ensures that exercise is safe and appropriate for their specific health condition. Conduct a thorough assessment of the individual's current fitness level, abilities, limitations, and any MS-related symptoms or complications. This assessment will help guide the development of an individualized exercise program. MS is often associated with heat sensitivity, which can exacerbate symptoms and impact exercise tolerance. Avoid exercise in hot and humid environments and provide cooling options such as fans, air conditioning, or cooling vests. Encourage your clients to hydrate adequately before, during, and after exercise. Fatigue is a common symptom in individuals with MS and can affect their exercise performance. So monitor their fatigue levels during exercise and modify the intensity, duration, or frequency of exercise as needed. Encourage proper rest and recovery periods between exercise sessions. Balance impairments and the risk of falls are common in individuals with MS, so incorporate balance and proprioception exercise into the program to improve stability and reduce their fall risk. Ensure a safe exercise environment and consider the use of assistive devices as needed. MS can cause mobility limitations and impairments in coordination and muscle strength. Modify exercises and provide appropriate assistive devices to accommodate these limitations. Consider seated or supported exercises and focus on functional movements that improve daily activities. Pay attention to any changes in symptoms during and after exercise. If symptoms worsen or become concerning, stop or modify the exercise accordingly. It's important to maintain open communication with the individual about their symptoms and adjust the program as needed. Start with lower intensity and gradually progress the exercise program over time. Incrementally increase the duration, frequency, or intensity of exercise to allow for adaptation and minimize the risk of overexertion or exacerbation of symptoms. Choose exercises that target specific goals and address the individual's needs, abilities, and preferences, and incorporate a variety of exercise modalities. Maintain open communication with the individual with MS and their healthcare team. Collaborate to ensure that the exercise program aligns with their overall treatment plan and any specific recommendations. And remember, each individual is unique, and their exercise program should be tailored to their specific needs and abilities. And monitor their progress, address any concerns, and make necessary modifications to the program as needed. So we're transitioning to epilepsy. Here we go. Epilepsy is a neurological disorder characterized by recurrent seizures. It is a chronic condition that affects the brain's electrical activity, leading to abnormal and excessive neuronal activity. Here are some key points about epilepsy. Seizures are the primary symptom of epilepsy. They occur due to sudden, excessive electrical discharges in the brain. Seizures can manifest in various ways, depending on the region of the brain affected. Common seizure types include generalized seizures, which affect the whole brain, and focal seizures that originate in a specific area of the brain. Epilepsy can have various causes. Some are idiopathic, meaning the cause is unknown. Other cases may be due to genetic factors, brain injuries, brain tumors, stroke, infections, developmental disorders, or certain conditions that affect brain function. Diagnosis of epilepsy typically involves a detailed medical history, physical examination, and diagnostic tests such as an EEG or electroencephalogram to measure brain activity during a seizure. Additional tests such as neuroimaging, such as an MRI or a CT scan, or blood tests may be performed to identify the underlying cause of epilepsy. The goal of epilepsy treatment is to control seizures and improve the individual's quality of life. The primary treatment approach is medication, with anti-epileptic drugs, or AEDs, being the most common form of treatment. AEDs help reduce or prevent seizures in many individuals with epilepsy, in some cases surgery. Vagus nerve stimulation or other treatment modalities may be considered. In addition to medication, certain lifestyle factors can help manage epilepsy. These include maintaining a regular sleep pattern, managing stress, avoiding seizure triggers such as specific foods or activities, and taking prescribed medications as provided by their healthcare provider. Individuals with epilepsy should take precautions to ensure their safety. This may involve avoiding activities that could be dangerous during a seizure, such as swimming alone or working at heights without proper safety measures. It's also important for individuals with epilepsy to communicate their condition to close contacts and educate them about proper seizure first aid. Living with epilepsy can have psychological and emotional impacts. It's important for individuals with epilepsy to have a supportive network, including family, friends, and healthcare professionals. Support groups and counseling can also provide valuable emotional support and education. Ongoing medical care is essential for individuals with epilepsy. Regular follow-up appointments with the healthcare provider allow for monitoring of seizure control, adjustment of medication, evaluation of treatment effectiveness, and addressing any concerns or side effects. Driving regulations vary by country and state, but individuals with epilepsy may face restrictions on driving due to the potential risk of seizures while operating a vehicle. It's important to follow local laws and guidelines regarding driving with epilepsy. Each person's experience with epilepsy is unique, and the management approach may differ based on individual factors. Working closely with their healthcare professionals specializing in epilepsy can help develop a tailored treatment plan to manage the condition effectively and improve their overall well-being. Epilepsy can be classified into several types based on different criteria. The most commonly used classification system is the International League Against Epilepsy classification, which categorizes seizures and epilepsy syndromes. Here are the main classifications. A focal or partial epilepsy is a seizure that originates in a specific area of the brain and can be further divided into focal seizures without impaired awareness, or formerly called simple partial seizures, or focal seizures with impaired awareness, where there's a complex partial seizure. And generalized epilepsy. which is a seizure that involves both sides of the brain from the beginning, can be further divided into absence seizures, formerly called petit mal seizures, myoclonic seizures, clonic seizures, tonic-clonic seizures, which was formerly called grand mal seizures, and atonic seizures. Epilepsy, where the onset of seizures is unknown or insufficient information is available to classify it into focal or generalized epilepsy, is called an unknown onset epilepsy. The signs and symptoms of epilepsy can vary widely between individuals and depend on the type of seizure and the area of the brain affected. Some common signs and symptoms include, of course, seizures. That's the hallmark symptom of epilepsy. And it can manifest in different ways, such as temporary loss of awareness or consciousness, uncontrolled movements of the body, limbs, or face, muscle stiffness or rigidity, sensations like tingling, numbness, or auras, altered sensations, emotions, or thoughts. The pre-ictal phase, some individuals may experience warning signs or changes in mood, behavior, or physical sensations before a seizure. This period is known as the pre-ictal phase and can vary in duration and intensity. After a seizure, individuals may experience a recovery period called the post-ictal phase. This phase can involve confusion, fatigue, headache, muscle aches, weakness, and memory difficulties. Some individuals experience an aura before a seizure, which is a warning sign or specific sensation that precedes the seizure. Auras can manifest as visual disturbances, smells, tastes, or other sensory experiences. Different epilepsy syndromes have their own specific signs and symptoms. These can include age of onset, specific seizure types, associated cognitive or developmental difficulties, and other distinguishing features. It's important to note that epilepsy is a highly individual condition, and the signs and symptoms can vary significantly between individuals. Proper diagnosis and classification of epilepsy should be made by a healthcare professional based on a comprehensive evaluation, including medical history, physical exam, and diagnostic tests such as EEG and imaging studies. Seizures in individuals with epilepsy can be triggered by various factors. These triggers can vary from person to person, and it's important for individuals to identify and manage their specific triggers. Here are some common precipitants of seizures. Lack of sleep or disrupted sleep patterns can increase the risk of seizures. Maintaining a regular sleep schedule and getting sufficient sleep is important for seizure management. Stress, anxiety, and strong emotional states can trigger seizures in some individuals. Finding effective stress management techniques such as relaxation exercises or therapy can help reduce the risk. Skipping or missing doses of anti-epileptic drugs or AEDs can lower seizure threshold and increase the risk of seizures. It's crucial for individuals to take their prescribed medications and as directed by their healthcare provider. Excessive alcohol consumption and recreational drug use can increase the likelihood of seizures. It's important to avoid or limit drug and alcohol use, especially in individuals with known triggers. Certain stimuli, such as flashing lights with photosensitivity, specific visual patterns, or certain sounds, can trigger seizures in some individuals. Identifying and avoiding these triggers can help reduce the risk. Exercise can have numerous benefits for individuals with epilepsy, including improved physical and mental well-being. However, it's important to take certain precautions and make appropriate exercise modifications to ensure safety. Before starting an exercise program, again, make sure that those with epilepsy should obtain medical clearance from their healthcare provider. This helps ensure that exercise is safe and appropriate for their specific condition. Fatigue and overheating can potentially trigger seizures in some individuals. Therefore, it's important to avoid excessive fatigue during exercise and take breaks as needed. Staying well hydrated and exercising in a cool environment can help prevent overheating. Select exercise with a low risk of injury or activities that can be easily modified to minimize the risk of falls or accidents during a seizure. Swimming with a lifeguard or exercising under supervision may be appropriate for some individuals. Exercise in a well-lit, uncluttered environment to minimize the risk of injury during a seizure. It may be helpful to exercise with a partner or have someone nearby who is aware of the individual's condition. Start with low-impact exercises and gradually increase intensity, duration, and complexity over time. Gradual progression allows the body to adapt and minimize the risk of triggering seizures. Some anti-epileptic drugs can cause fatigue, dizziness, or muscle coordination issues, which may affect their exercise performance. Individuals should be aware of the potential side effects of their medication and adjust their exercise routine accordingly. It's important to maintain open communication with the healthcare provider and report any changes in seizure frequency or severity. Regular monitoring of seizure activity and adjustments to the exercise program may be necessary. Every individual is unique, and exercise recommendations should be individualized based on their specific conditions, seizure type, and overall health. Consulting with their healthcare provider and working with individuals with epilepsy can provide personalized guidance and support in developing an appropriate exercise plan. Exercise testing and training for clients with epilepsy should be approached with caution and individualized based on their specific condition, seizure control, and overall health. Here are some considerations for exercise testing and training clients with epilepsy. Before initiating an exercise program, they need to undergo a thorough medical evaluation by their healthcare provider. That should include a detailed medical history, physical examination, and review of seizure control and medication regimen. It's important to ensure that seizures are adequately controlled before starting a modified and exercise program. Uncontrolled seizures may increase the risk of exercise-related injuries. Their healthcare provider may adjust their medications or treatment as necessary to optimize seizure control. Exercise testing, such as graded exercise stress tests, such as treadmill or cycle ergometer tests, may be conducted to assess cardiovascular fitness, exercise capacity, and identify any exercise-induced seizure risk. The testing protocol should be modified or individualized based on the client's seizure history and specific needs. Choose exercises that are low impact, well tolerated, and safe for the individuals with epilepsy. Activities such as walking, cycling, swimming, or low intensity aerobics are generally recommended. High impact or contact sports with a risk of head injury should be avoided or approached with caution. Start with low to moderate intensity exercises and gradually progress as tolerated. The duration and intensity of exercise should be individualized based on their fitness level, seizure control, and overall health. It's important to monitor for any signs of increased seizure activity during or after exercise. Exercise sessions should take place in a safe environment with proper supervision. Ensure that there is access to medical assistance in case of a seizure or other emergency. Inform exercise partners, instructors, or trainers about the client's condition and appropriate seizure first aid procedures. Individuals with epilepsy may be more sensitive to heat, which can potentially trigger seizures. Implement cooling strategies, such as exercise in a ventilated and air-conditioned environment. Stay hydrated and use cooling aids if needed. Each person with epilepsy may have different needs and limitations. It's essential to tailor their program to the individual, considering their fitness goals, abilities, preferences, and any specific considerations related to their epilepsy. Regularly monitor the client's response to exercise, including seizure activity, medication side effects, and overall well-being. Maintain open communication with the client's healthcare provider to provide updates, address concerns, and make any necessary adjustments to the exercise program. It's important to emphasize that exercise testing and training for individuals with epilepsy should be done under the guidance of their healthcare professionals experienced in working with this population. They can provide specific recommendations and ensure that the exercise program is safe and appropriate for the individual's needs and condition. And that is all that I have for you today. This is part 2. We will be going into part 3 next. I look forward to talking with you again. Have a great day.